Hi, good morning. I'm Dr. Philip Umschneider at the Ozark Chiropractic Clinic. I'd like to welcome to our video this morning. We're going to hit upon a common question I get from patients frequently, and that is, should I use ice or heat when I hurt myself? Okay? Whenever you have a new injury, whether you fell, you hurt your back, whether you twisted an ankle, hurt a shoulder, or in a car wreck, or whatever, always use ice for new injuries, acute injuries. You're going to put it on for 20 minutes on, off for an hour. I love using these reusable gel packs. We have bigger ones that we give to our patients who come into the office, but these are great to have in your freezer. When you pull them out of the freezer, wrap a light towel around it, and you're going to apply it to the area where you're hurt, whether it's your neck, shoulder, knee, back, whatever. You use it for 20 minutes on, off for an hour. And I generally tell patients to use it about 3 times a day at least. Now you can do it more and things. What the ice will do is it'll help get the swelling down, because whenever you injure tissues, you're going to have the damage occurs there, they're going to be inflamed, there's going to be more blood flow, and there's heat. So we want to use the ice to decrease that effect. It has a numbing effect, decreases inflammation, decreases blood flow. So that's where we're going to use the ice first on new injuries. You may have heard of a common acronym. It's called RICE. It's called Rest, Ice, Compression, Elevation. You know, you rest the part, you put ice on it. If you compress it, you can. Elevate, if you can, that's fine to do with the extremities. Sometimes it's not practical. So that's something you can think of also. Now, I have some patients who say, I don't like ice. It just bothers me. Okay, heating pads then. So let's talk about those. When you use a heating pad, you always want to use it maybe 25, 30 minutes. And there's some general rules. You do never want to sleep on a heating pad, okay? Do not lay on them when you're using it also, because what that can do is when you're laying on top of the heating pad, you get more blood that actually can pool in that area, which can increase the inflammation, make the injury worse. And you also have the potential of burning the skin. And that's not good, so we want to avoid that. So whenever you use a heating pad, maybe put it up against the back of a chair, sit up against it, lay on your side, have it on top of you, or lay on your stomach and have it on top of the area. But do not lay on top of it or do not sleep on them, okay? And that's a good rule of thumb for heating pads there. Now, like I say, I'm a big ice fan. I'll use ice more than anything for my injuries that I have and things. But after a week's time, if you want to go from the ice to heat, you can use that. And then sometimes you can even contrast. You can use ice one time, heat the next. And a general rule is if new injuries, like I said before, always use ice first. If you have chronic injuries, things that you've had for years, aches and pains, stiffness, the heat may be more comfortable for you. And that's fine to use. So about 25 minutes on, off for the hour, and use it off and on throughout the day as you need to. Again, certain injuries just don't do well with ice, or certain conditions, I should say. Things like rheumatoid arthritis, some arthritic joints, some vascular problems do not do well with ice. So you need to be careful with that, and you'll generally know what feels good or what doesn't to you. Because if the ice doesn't work and you just don't like it, don't force yourself. Don't use it for that. One little trick I'll tell patients is, with your ice packs, if you suffer with headaches, I'll tell patients, put that ice pack right along the base of the head, the neck up in here. That helps a lot of times decrease some of the throbbing, some of the pain that's going on with there. And then get yourself adjusted. That's going to be the best thing to help you with that problem. And again, if you do injure yourself, and after 2 or 3 days, if it's not improved, you need to have yourself checked. Call the office here, get yourself in, get that checked and adjusted. It's going to heal better. You'll have less problems down the road and it won't become a chronic issue too. So I hope that answers any questions you may have had. Share a little information with you. We're having a patient appreciation week coming up on the 17th of April through the 24th. Any new patient can get their exam or x-rays at no charge. That's a fabulous opportunity to take advantage of that. Help somebody out, help a family member or friend. If you have questions, always call me at 479-667-5053. Check out the Facebook page. If you're watching us now, the website's ozarkchiropractic.com. But I want to thank you for your time. I appreciate your attention, and I hope to see you in the future. Thank you very much.